You might be asking yourself, why are sleep apnea and obstructive sleep disordered breathing seemingly so common nowadays? Most of us know someone who struggles with sleep apnea, snoring, or overall bad sleep, and that someone might even be you. Are these disorders becoming more common, or are we getting better at diagnosing them? The answer is probably a little bit of both. First, changes in cultural behavior and diet have heavily influenced our human development over the past few decades. Historically, the human jaw forms as response to certain stimuli, which promote growth of the face and jaw to reach full genetic potential. One of the major stimuli for upper jaw formation is connected to breastfeeding. Breastfeeding engages the jaw, specifically the maxilla, which is the upper jaw, and promotes proper growth over time. Culturally, we have shifted to introducing or substituting bottle feeding early in a child's development for various reasons, and thus the breastfeeding stimulus is less impactful. In the past, children were breastfed for longer periods and they were weaned to hard, solid food, which promote jaw and tongue strength. The shift to earlier weaning and intermediary soft foods has impacted jaw development and tongue strengthening. With the changes to our diet and cultural evolution around breastfeeding, it's becoming more common for the upper jaw or the maxilla to be underdeveloped. In addition, when you have a maxilla that isn't fully formed, the mandible or lower jaw cannot grow as far forward as it is meant to be. Finally, when the maxilla and mandible are underdeveloped, there's often not enough room for the tongue, and that can cause airway restriction and obstruction. Some common signs that you might struggle with airway restriction or sleep disorder breathing include snoring, teeth grinding, waking up with a headache, daytime drowsiness, blood pressure problems, difficulty losing weight or unexplained weight gain, scalloped tongue, where the edges of your tongue have small grooves from pressure against your teeth, dark circles under the eyes, mood swings, and anxiety. Airway restriction and sleep disorder breathing is not just a problem plaguing adults, but it can also impact children. Breathing disorders can lead to developmental changes, physical and cognitive development delays. There are links to ADHD and hyperactivity diagnosis in children. Sometimes bedwetting can be connected to sleep disordered breathing. Even things like frequent colds, chapped lips, chronic ear infections, sore throats may be related to airway restriction or sleep disordered breathing in children and adults. The good news is, just because your face might not have reached full genetic potential during childhood, it's not too late to address the problem in adulthood. And it's certainly never too late to start getting a good night's sleep.